Okay, good morning, namaste and salam alaikum. It's a great pleasure and my honor to be here at KIMS Bibi Cancer Institute, which was the first privately set up cancer institute in whole of Andhra Pradesh and one of the very first in the country. I am very pleased that this was inaugurated by me, Mr. Anjay. I was just looking at in 1981.
Yes.
This is amazing to see the progress being made over 35 years. We have been the pioneering institute in Andhra Pradesh, Telangana, and also in India to bring the latest technology from the Western countries, especially the USA, which is the most advanced in the cancer care, to India and mostly to baby. It is recorded in the history of this last 35 years that the services the Bibi Hospital has provided to the community, not only from the local area, but throughout the state and sometimes from other countries. We had ongoing partnership with institutions in USA and brought all the technology and training. A lot of the oncologists from India were trained in USA and were practicing all over the country. The next biggest step which occurred in our history of BB was association with KIMS. The chairman of the KIMS is a good friend of mine, Dr. Sahadullah, who is himself a cardiologist well known, and he started the KIMS Institute initially in Kerala, which is now one of the busiest multi-speciality hospitals in the country. And they have several hospitals in India and also in Middle East countries. We have established a combined cancer center in Kerala, which has been open for 5 years. We developed the relationship and co-own Bibi Hospital and has been renamed as KIMS Bibi Institute of Oncology or Hospital and Multi-Speciality. Since then, we have been working together very closely, and Mr. Sadar has been appointed the chief doctors in USA and also here in India, and is considered as the top equipment manufacturer and the highest technology. And that's what it is, Rapid Art. We have in Kerala also, and we have in several institutions in USA. This technology is very advanced. This not only it gives the radiation in a very precise manner, but during the treatments, when the patients have a movement or the breathing, the tissues move, the tumors move, but this technology targets and follows the tumor. It's called IMRT and IGRT, which is image-guided radiation. It has a technology where during the treatment or before the treatment, you take the images, you confirm the treatment with the plan and follow it. So this gives a very accurate treatment. And for the patients, the biggest benefit is, number one, you treat the tumor without damaging the normal structures around it, and also minimizes the complications. Like when you treat patients, a lot of vomitings, diarrhea, skin reactions, difficulty in swallowing, those are minimized. Cannot be eliminated completely, minimized, less, and much more effective treatment. Because you are targeting the tumor, you can give a higher dose, so cure rates are much more. So this, in combination with brachytherapy, which is putting the radioactive sources directly into the tumors, is again we are pioneer in this technology, and we have trained many people all over the world and in India, and this is institution provides the high dose rate brachytherapy, which helps
The institution, as you all know, already said it has been always pioneering the newest technologies and patient care standards. We will continue to do that, especially with the partnership with KIMS now. That gives us much more stronger resources and capabilities to constantly upgrade, because as you know, the disease of cancer is increasing all over. It's a major concern, it's a public healthcare concern. We as an institution from the last 3 decades, it is our duty to continue to provide the best platforms for cost-effective patient care services, and I appreciate that KIMS has come forward. So with this beautiful alliance, we will continue to serve for the next 20, 30 years as the patient, unfortunately as the disease progresses. But a major focus will be on early detection. It's one of the major concerns in India. Still we see 60% advanced cases. It is our earnest desire to reach out, to do camps, to do surveillance, to do early detection, because unless patients come in early stages, you really are not going to give results which we desire. So it's always about public awareness, surveillance, which is also extremely important. As we know in the US, patients come in early stages, and we still have our
starting pre-operative investigations भी होते हैं, post-op follow भी free consultations हो जाते हैं, और जो ट्रीटमेंट के लिए एडमिट होते हैं हॉस्पिटल में वो भी ट्रीटमेंट होता है. जो आरोग्यश्री बेनिफिशियरी डायरेक्ट बेनिफिट ले सकते हैं, उससे कुछ भी चार्जेस नहीं लेते. कंसल्टेशन, इन्वेस्टिगेशन और ट्रीटमेंट का हम लोग कुछ चार्ज यहाँ आंध्र प्रदेश और तेलंगाना स्टेट के नहीं, बल्कि हम लोग कर्नाटक से बहुत सारे